Next up, we have Dr. Abtin Foroohar. Dr. Abtin is a dual fellowship-trained orthopedic surgeon specializing in hand, micro, and upper extremity surgery. He is not only an advocate for patients, but for physicians, co-chairing Kaiser Permanente South Bay Medical Center Physician Wellness Committee and leading the Pathway to Partnership program for all new physicians. Please join me in welcoming him.
Thank you so much. It's a pleasure to be here, and I'd like to thank this audience, and I'm glad to see that we have diversity of healthcare professionals here, including diversity in the fight against burnout and the fight for wellness is really important. Before I start, I'd like to say that it's a pleasure for me to come back to UCLA, my alma mater, and thank the Fielding School of Public Health. As you can tell, one of my administrative partners, Ms. Alicia Popoff, a recent graduate of yours, has been an amazing asset to our institution in leadership development and in our executive development. So we're proud to have her, and I'm proud to be here. Tonight, I'm going to talk to you about burnout, but also a little bit about physician wellness. And maybe this is one of the most important slides that I'll show you tonight. I'll show you the other one as well. I like it because the word wellness is really important. It's very important in our fight against burnout. One of the reasons it's important is because burnout and the fight against burnout is not an individual sport. It's an active sport and a team sport. What I mean by that is that you cannot one day meditate and then be well. It's an active, everyday work towards finding balance, changing what you need to do to find new resources to fight your challenges. So it's an active sport, not a passive sport. And it's a sport that includes all of us, nurses, physicians, administrative leaders, healthcare institutions. So not a one-man sport. That's why if you look at the word wellness, there is a we in wellness. However, if you take the word we out of wellness and you put an I, it becomes illness. I would like you to keep that in mind. I would like you to keep that in mind when we go through this talk about inclusion and about having a group sport and working at fighting burnout together. Today I'll talk really quickly about, is burnout real? Is it really happening to our healthcare force? And then we'll talk about, is burnout affecting patient care, right? And finally, what different strategies healthcare systems have taken to address burnout? And finally, some of the things that we're doing in Permanente medicine. Is it real? Is burnout really happening? And I know that we've had a lot of presentations on this before, but some of the more recent data that we've seen is that it is a very significant factor, and it does really exist. The Mayo Clinic did a review of physicians and compared it to their previous review in 2011 and found that the rate of burnout is up to 54%. It's up 7.6% from their previous study a few years before. Not only that, a great paper out of Stanford recently showed that physician burnout is up to 33% as compared to a previous study they had done, and also that physicians were having a lot less fulfillment from their jobs, specifically female physicians. And this is something that I'll touch upon a little bit further in my presentation. And finally, and this is somewhat of an older study, one of my favorite studies, the MEMO study, looked at the amount of control physicians have over their environment, like how long you have to see a patient, who is your nurse, and when you see patients, and what kind of stuff you have in your environment and your say over that. And they categorized physicians who said that they didn't have a lot of say, a lot of control, as having a chaotic environment. And those who had a lot of control were not chaotic. If you look at the chaotic category here, which is red, anytime the chaotic category outlasted the not chaotic category, that physician or healthcare provider or nurse was going to leave, was burned out, or stressed. Whenever they had more control than lack of control, there was more satisfaction. This is significant. What this tells our administrative partners and all of us is that we need to have some say in our own environment to be able to perform well in that environment. So enabling your nurses, enabling your physicians, enabling your care extenders to have say in the way that they practice enables them to practice better. And that's an important point in the we in wellness. Well, the next question is, well, it exists. Does it affect patient care? Can I just fire the one doctor that's burned out and will that solve this problem? Unfortunately, no. The answer is that it affects our patients and it affects our care. There's two papers here. One showed that there is a substantial amount, a significantly noted amount of decreased patient satisfaction when they were interacted with a physician that had at least one symptom of burnout. Secondarily, we found that there was actually a longer hospital stay for patients who were in the treatment of a hospitalist who had some evidence of burnout, and specifically in depersonalization. So it does affect patient care. Why is that important? Because it goes back to the notion of we in wellness again. If you look at this chart, and I'll just kind of briefly discuss it, it's a little complicated, but these are all the things that can cause stress for physicians. These are some of the contextual factors like, board problems and stuff like that. These are characteristics of physicians that hurt ourselves, self-neglect. When all these things add up together, you get outcomes that have to do with depression, relationship breaks, burnout. That affects what the healthcare system cares about: patient satisfaction, patient outcomes. And so if you look at this chart and say to yourself, well, if we intervened here, here, and here, we could potentially save patient satisfaction and patient outcomes, which could mean financial ramifications for the healthcare system, the bottom line healthcare dollars. So the well-being and the wellness of your nurses, your doctors, and everybody else is crucial for the entire health system's outcome. So it is a sport that is all of us that are involved in, not just physicians and nurses. That's why now we talk about, as opposed to the triple aim, the quadruple aim. Before, the triple aim from the IHI was, and in layman's terms, we could put this as affordability, quality, and patient satisfaction. Now we have affordability, patient satisfaction, quality, and the wellness of the providers. So now we have the triple aim went to the quadruple aim because of the fact that healthcare institutions started to realize that this is a group sport. We all have to kind of pitch in and lean in to make this work. So what we've based our work on is from the Stanford work, and they have developed a system based on their research that showed that wellness and professional fulfillment can be divided into a few categories. One is the culture of wellness, the other one is efficiency of practice, and finally, personal resilience. They found that each of these had various factors that were statistically significant towards wellness of the provider, meaning that if the provider ranked them lower, there was a statistically significant chance that they were more likely to burn out. Okay, some of these examples of culture of wellness is perceived appreciation. An example of, for example, personal resilience is sleep and self-compassion. Finally, efficacy is healthcare, is electronic medical records efficiency. We have based a lot of our system on this. More importantly, when they took the data and extrapolated it differently, instead of saying that we're going to prevent burnout, well, why not promote professional fulfillment, the other end of the spectrum? When we look at it that way, think of preventing something bad is not as good as promoting something good. When you look at it that way and reestablish the data, they found that there was a significant relation with leadership support to appreciation, values alignment, meaning that leadership is aligned with frontline physicians, and peer support. And those were found to be statistically significant and related to professional fulfillment. From this, you can extrapolate that leadership support is really important in fulfilling, in professional fulfillment and the fight against burnout. This is a very important slide. Well, what do? Well, our leaders are quite involved. This is our CEO and Executive Medical Director, Dr. Ellison and Dr. Don Clark. They run our program. This was from a TED Talk a few days ago on the importance of fighting burnout. And fortunately, our program was the winner of the Gary Nye Award, of which Dr. Miyoto won the year before as well, who will talk after me. So we're very proud to be a co-panelist with her. We're very proud of our program. Some of the ways that we fought burnout and promoted professional fulfillment are through our 5 pillars of promoting prevention, professional development, practice management, collegiality, and healthy lifestyle. We are 15 medical centers as a group. We have nearly, at this point now, we have almost 8,500 physicians and 4.5 million patients. So our wellness committee runs basically through 15 different subcommittees, and they all basically integrate into one main wellness committee. And that's enabled us to have centralized goals and deliver those goals through a personal local touch. So it helps us kind of move the needle a little more. We have significant leadership support with allocation of resources and time and management resources. Finally, we get to work with every part of our medical system. We work with electronic medical records. We work with new physician development. We work with leadership development to make sure that the footprint of wellness and the fight against burnout is in every part of the hospital, for everyone, from nurses to doctors, so that it's always there as a resource. And why are resources important? Well, we'll talk about it in a second. Do you remember this? I just showed this a couple minutes ago. Our program, each one of our programs has within their committees and a variety of different subcommittees. So for example, a second victim program to help those who had adverse outcomes, to fight financial well-being, for leadership development. We try to work as much as we can with new physicians to teach some of the things that maybe some of the med schools may have left out as far as self-care. We have a healthy diet program, a volunteerism program, and also a women in medicine program. So if we were to take these programs from each medical center, for 15 medical centers, and divide them, well, your culture of wellness programs are the ones that are in light blue. Your efficacy of practice are financial well-being and EMR tips and tricks. And we have a whole program for each of these, for every physician, for non-physicians to participate in. And finally, personal resilience. Some of the things that we found to be very important are parenting courses for new parents, transitions programs for people who had a death in the family or perhaps through a difficult life transition. And these are made available to every chief of every department and every chairman. Lastly, we try to expand our footprint into the new physician development. So anyone who gets hired by our system automatically goes through a new physician development. And in that new physician development are surprisingly whole talks on wellness, really an importance of emotional intelligence and leadership development. Finally, and this is my last slide, and I said I would say there's one more slide that I really like. We talked a lot about, is it real? Does it affect patients? What do health systems do? But in reality, as a wellness leader myself, I get physicians who come to me and nurses and healthcare people that say, I'm really burnt out. And I can't tell them to use the Stanford model to get better. That doesn't work. They need a more realistic answer. And I think this is the more realistic answer. The answer is that for all of us, wellness is an active sport. We have to work at it every day. We have to take our resources and our challenges and try to balance them. And this is like the practice of medicine. It changes. Your resources will change as you go through different phases of your life, right? Depending on where you work. Your challenges will change depending on what patient you're seeing and what day of the week it is and such and so forth. I try to teach our providers to balance both. In my presentation tonight, I went through 15, 20 different resources that just our institution provides. I'm amazed at what UCLA and what Cedars also provide. But each person has to take it on themselves to balance their own seesaw, to take your challenges and to find resources to balance them. And this is a mentality that you have to live with in order to have a work-life balance. It changes at every part of your life. It changes every day depending on your challenge. And if we can kind of teach this to our medical students, to our nursing students, and to our providers, then they can adapt and grow to be able to be more resilient, to provide better patient care, and to be better providers overall. It's been a real pleasure to present to you. It's an honor to be here, and I thank you for the opportunity.